Hey guys, it's Dr. Kamel, and we're going to continue on in our ultrasound series, and today we're going to discuss midfoot ligaments. I especially like this topic, and you want to know why? Well, it's because midfoot ligaments can be a cause of midfoot pain that are oftentimes confusing and hard to make a diagnosis in our clinic. And if you get a radiograph in your office, it is not going to show you that there is midfoot ligamental pathology. So instead of sending your patients out for an MRI, you can make an easy, quick diagnosis in your office using an ultrasound. So we're going to discuss a few ligaments of the midfoot, but one of them that I want to talk to you now about is the spring ligament. Now, the spring ligament is important as it is one of the structures that helps to form the arch and is oftentimes pathologic in patients with acquired flat foot deformity. So with your patients that have acquired flat foot deformity, you can use the ultrasound to identify the spring ligament and identify if there's anything pathologic with it. Now, in another video, I discussed the posterior tibial tendon. So if you use the skills from that video with this video, you can use them together to help identify why your patient might be experiencing flat feet. Alright, now I'm going to show you guys how you can use an ultrasound probe to identify three midfoot ligaments. So we're going to do First, we're going to do the superior medial portion of the calcaneonavicular ligament, also known as the spring ligament, and then also the dorsal talar navicular ligament, as well as the dorsal calcaneal cuboid ligament. So we'll start here with the superior medial portion of the calcaneonavicular ligament, or the spring ligament. And here you can see three bony structures. On the right side of the screen, you'll see the navicular, and on the left side of the screen you see the calcaneus, and in between them is the talar head. And you can see that the superior medial portion of the calcaneonavicular ligament is a little bit more broad than a typical ligament, and you can see it connecting the calcaneus and the navicular there. It is a fibular structure. You can also see the posterior tibial tendon running just superficial to it, right there. It's a little bit difficult to find the spring ligament as it is a little bit of a deeper structure, but just knowing your anatomy is very helpful in identifying these structures. Now we'll move on to the talar navicular. So pretty simple here. Just knowing which side of the probe you're on by tapping. I know that the right side of my screen is the more distal portion, so the navicular, I can see the joint there, and by manipulating the foot I can get a little bit of distraction, which is helpful in identifying the ligament. You can see it right there, just dorsal to the joint, and it appears to be intact without any pathology. You might be able to see the anterior tibial tendon in this view as well. And lastly, still making sure that this part of the probe is distal. So right over the calcaneal cuboid joint. Right, so making sure you scan, make sure you know your anatomy and scan. When you scan, you'll start to see some of the bony structures come into view. So right away there, I see the calcaneal cuboid joint, and just dorsal to it, I can see the calcaneal cuboid ligament, which appears fibular and intact without any signs of hypoechoic effusion or any tears or any ruptures. Alright, so I'm going to show you guys some pictures now with some pathologies related to these, and to help you further identify these and be a little bit more keen at finding these structures and identifying any pathology. When the probe is placed in the correct position in the longitudinal axis, you can see the calcaneus and the cuboid come into view, as well as the dorsal calcaneocuboid ligament, which is in a normal fibular echogenic structure. Similarly to how we identified the dorsal calcaneocuboid ligament, the dorsal talar navicular ligament, as long as the probe is placed in the proper position, as you can see here indicated, the talus and the navicular will come into view, and you can see the normal fibular echogenic structure that runs and connecting the two dorsally. The dorsal talanavicular ligament injury usually follows a plantar flexion inversion injury and can clinically mimic a lateral ligament complex injury. In this image, you can see the fibrotic, inhomogeneous nature of the ligament, and as opposed to its normal homogeneous fibular echogenic structure, it is now more hypoechoic. Here is a long axis view of a normal superior-medial calcaneonavicular ligament. You can see there are three bones here, the calcaneus, the talus, and the navicular, and the spring ligament spans from the calcaneus, just grazing over the talar head and buttressing and supporting it, and inserting into the navicular. You could also appreciate the relationship of the posterior tibial tendon as it sits right on top of the spring ligament and is separated by loose connective tissue to allow for easy gliding. Now here in this image, also in the longitudinal view, you can see the superior-medial calcaneonavicular ligament, or the spring ligament, has a partial tear. And this is indicated by the yellow markings here. You can see the hypoechoic spaces, which are consistent with tears within the ligament. You can also appreciate the relationship again of the posterior tibial tendon with the spring ligament. And also you can see that there is some effusion indicated by the blue markings surrounding the hypoechoic space nearby the ligament, which is also consistent with pathology to the spring ligament. Thank you guys so much for watching. I'm excited for the next video in this ultrasound series, so stay tuned, you guys. Thanks.